Hi guys, Dr. Berg here. I had a question recently about aspirin, okay? Now, first of all, check with your doctor. I'm not giving you any medical advice for this. I'm just giving you some education and on some other viewpoints on aspirin. Some people are taking it as a preventative measure for heart attacks and stroke that don't have any problems with their blood work or don't have any problems. They just want to prevent it. Other people do have problems and they're taking it. And some people are taking it for pain and inflammation, okay? So the thing that you need to know is that one of the side effects from taking aspirin is that it creates damage on the liver, especially if you take a lot of it. And it also creates internal bleeding. It also creates kidney problems. Okay, it's right on the label, you can just read that. Over 6% of the group of people who take aspirin end up hospitalized, okay? And 15,000 deaths a year in the US alone from aspirin. So it's not 100% safe. But people say, well, it's also not safe to be at risk for heart attacks or stroke. I understand that, but I just want to give you some alternatives to look at. If you wanted an alternative, you can check with your doctor to see if you guys can work out the but make sure you check with your doctor to make sure that you both are in coordination. But cod liver oil is a very great oil for the heart, also to thin the blood naturally. It has vitamin A, it has vitamin D, it's good for the immune system, it's good for the cardiovascular system. If you wanted to get cod liver oil, I would search out a virgin cod liver oil. It's just higher quality, it's a little more expensive, but it's definitely worth it. Number 2, vitamin E. Make sure the vitamin E you get is a complex, a natural complex, not a synthetic like alpha tocopherol. You want to get the whole complex and make sure it's more of a natural version. Vitamin E also is great for the heart, good for angina. It's good for supporting a healthy heart, cardiovascular system. And of course, probably vitamin C too, to strengthen the capillaries and the arteries to help support your vascular system so you don't get a stroke. Vitamin E is very important. Make sure it's a natural food-based vitamin C complex, okay? Now the other thing is if you're taking aspirin for pain or inflammation, there's some other things that you may want to do to go deeper. Cod liver oil is a great anti-inflammatory, that's one thing. Number 2, stinging nettle root is one of the best natural anti-inflammatories that I know. And it's natural, it doesn't have any side effects, and it works really good for anything like arthritis and pain. I like this one. Also, intermittent fasting and keto. If you're watching my videos, you know all about this. If you don't, start watching the intermittent fasting and keto combination, ketogenic diet, because this will drop inflammation probably faster than anything that I know. Next thing, if you have gout, inflammation from gout or rheumatoid arthritis, you need a lot of potassium. Make sure the quantity of vegetables are between 7 cups and 10 cups a day. In addition to that, you might want to get a potassium supplement, maybe electrolyte powder, to really increase that to lower inflammation as well. All right? Thanks for watching. Hey, you probably already subscribed, but if you haven't, press this little button down below and I will keep you updated.